Embryology is the study of how organisms develop from fertilization to forming their complete structure. For medical professionals, understanding embryonic development is essential for comprehending structural formation and congenital anomalies. This video will explore the development of facial structures, palate formation, tooth development, salivary gland and temporomandibular joint development, craniofacial skeletal formation, tongue development, innervation of the oral cavity, and the vascular supply to the face and oral cavity. In the development of the face, three prominences known as the frontonasal, maxillary, and mandibular prominences play crucial roles. The frontonasal prominence forms the forehead, bridge of the nose, and upper lip. The maxillary prominence contributes to the cheeks, upper lip, and secondary palate. Lastly, the mandibular prominence shapes the lower jaw and lower lip. Throughout growth, fusion, and differentiation processes, these prominences interact to form the intricate facial structures seen in adults. The primary palate development involves the fusion of the medial nasal prominences and maxillary prominences. The medial nasal prominences, which contribute to the formation of the upper lip and philtrum, fuse together along the midline. Concurrently, the maxillary prominences, derived from the first branchial arch, migrate medially and then fuse with the medial nasal prominences. This fusion forms the upper lip, the primary palate, and the alveolar process of the maxilla, which houses the developing teeth. During the development of the face and oral cavity, the secondary palate is formed through a complex process. The palatal shelves grow and elevate on both sides of the developing tongue, merging to form the secondary palate. Fusion starts at the back and progresses towards the front. However, if this fusion is disrupted, it can result in a cleft palate. Genetic and environmental factors, including disturbances in signaling pathways and mechanical forces, can impact the growth and fusion of the palatal shelves. Cleft lip and palate are common birth defects where the lip or the palate, respectively, do not fully develop. They can affect feeding, speech, and dental health. Tooth development occurs in sequential stages: initiation, bud, cap, and bell. This involves the formation of dental placodes, invagination of tooth buds, proliferation, enamel/dentin formation, and differentiation of dental tissues. Molecular signaling pathways regulate this process. The dental lamina is a specialized thickening of the oral epithelium that forms along the future dental arches. It serves as the foundation for the initiation of tooth development. The dental lamina undergoes differentiation, giving rise to enamel knots, which guide the patterning and morphogenesis of teeth. Additionally, the cells within the dental lamina undergo histodifferentiation, leading to the formation of different dental structures, including enamel, dentin, cementum, and dental pulp. The development of salivary glands involves the growth and differentiation of epithelial cells to form major and minor salivary glands. Dysfunction in this process can result in dry mouth and salivary gland tumors. The temporomandibular joint, TMJ, is a specialized joint that allows for jaw movement during eating and speaking. It involves the formation of the mandible, articular disc, and related structures. Various cells and signaling molecules play crucial roles in TMJ development. In craniofacial skeletal development, bones in the head and face form through a process called intramembranous ossification. This involves the differentiation of mesenchymal cells directly into bone. Primary ossification centers form, and ossification spreads from the center to the periphery. Facial bones, like the maxilla and mandible, are formed through the fusion of multiple primary centers of ossification. Genetic factors, signaling molecules, and mechanical forces regulate these processes. Tongue development involves the differentiation and fusion of lingual swellings originating from different embryonic cell types. The anterior 2/3 of the tongue arise from the first pharyngeal arch, while the posterior 1/3 arises from the third and fourth pharyngeal arches. These swellings consist of cell populations derived from both the endoderm and ectomesenchyme. Signaling molecules, including sonic hedgehog, play crucial roles in regulating tongue development, ensuring proper patterning and differentiation of the lingual structures. This section explains how the oral cavity receives its nerve supply during development. The trigeminal nerve, CNV, and facial nerve, CN7, play important roles in providing sensory and motor innervation to different structures in the oral cavity, including the teeth, gums, mucosa, facial muscles, and anterior 2/3 of the tongue. It is crucial to understand the development and pathways of these nerves to comprehend the sensory and motor functions of the oral cavity. The face and oral cavity receive oxygenated blood from arteries such as the facial artery, maxillary artery, and lingual artery, which arise from the external carotid artery. Understanding these arteries' branching patterns and clinical implications is essential for dental and surgical procedures in the facial and oral regions. Venous drainage is accomplished through a network of interconnected veins, maintaining proper circulation and venous return. Understanding the complex embryology behind the development of the face and oral cavity is essential for medical professionals. This knowledge can help prevent and manage congenital anomalies, and further research will improve patient care.